Knock knock.
Come in.
Hello, my name is Michael Argerin. I'm a student from Nevada State College, and I'm here to do an IV catheter on you today. The doctor ordered a normal saline for you, just to make sure you have a balanced electrolyte. Okay? Can you please say your name and date of birth for me, please?
My name is Michael Smith. I was born January 1st, 1970.
All right, Mr. Michael. Is that what you want to call Mr. Michael?
Yes.
Okay.
Mike is good.
Mike is good. Okay. Okay, Mike. Are you left-handed or right-handed?
Right-handed.
Right. So I'm gonna use your left hand for the IV catheter. Okay? For the IV. Okay.
Okay.
Do you have any allergies to medication, or any iodine allergy, or latex allergy at all?
No.
Good. Do you have any questions for me?
No, let's just get over this.
All right then. So just relax, okay? And make sure that you assess your patient for respiratory, assess your patient for any trauma, or if he has any surgery, and also check for bleeding tendencies before you start your IV. So now first, since I don't have a new saline bag, just double check for the IV infusion kit. Make sure it's not expired and you have the right solution, and make sure that there's no leaking or anything at all. And then once you start the spike of your once you spike the infusion bag, make sure that there is no any bubbles in the tubes. So what you can do is unclamp it and try to just flush a little bit of water out. If you can take it off. And once it's good and make sure there's no bubbles at all, you can go ahead and clamp this back on. So now it's back. And make sure that everything's good. There's no bubbles at all, and now you can start your IV infusion, your IV catheter. So we can hand hygiene again. Make sure you start your pump, or maybe you can do this first before you start your IV catheter actually. So first I'm gonna have to put this in here. This machine will indicate, will let you know if there's any bubbles or occlusion on the tubing. So it's very important to connect this here, just to make sure. So once it's all connected and secure, you can close this and hang this back here. And make sure that you're not contaminating this part, because this will go to your patient's IV tube, so it won't contaminate it, just to secure that there's no any contamination and might result in inflammation. Alright, now hand hygiene. And you can start with your patient. So, Mike, I'm just gonna look for vein, okay?
Okay.
Okay, first, just make sure you have all the stuff you need for the IV. And using the tourniquet, you can go look for a vein, wherever is a good one. So it's gonna be a little tight, Mike, okay?
Alright.
I'm just gonna check for vein. Make sure you make sure the tourniquet is 6 to 8 inches above the IV site. And tell your patient to careful. Alright, so first look for a vein. Oh, I see a really good vein right here. So I'm gonna use this mic, okay?
Mm-hmm.
Make sure you don't leave your tourniquet too long. And now you can clean the IV site. So, and then you can go from back and forth motion. Make sure you're not contaminating it. Or you can also go for circular motion, avoiding the contamination. So when it's done, just wait until we get ready. sharp container is right here. Make sure you have your sharp container. And wait till the alcohol gets dry, okay? So now once it's dry, make sure you, while you're waiting to get dry, for the alcohol to dry, you can prepare all your stuff. So maybe you can connect this part and this right here, and make sure you're not contaminating this also. And for the pigtail, let me just grab my pigtail really quick. Give me 1 second. Alright, make sure you have the extension set. So this can go so now you can, this is also a sterile part, but before you start everything, you make sure that this flush it a little. Just to make sure. That's good. And this is sterile, so maybe you can leave this here for now. So make sure you're not contaminating this part. So once it's wait. Alright, Mike, I'm gonna start the IV, okay?
Okay.
Change the right now the alcohol is dry. You can start to 6 to 8 inches above the side, above the IV side. And you can tie it. Make sure you not forget to take the tourniquet out. Okay, now it's dry. You can go grab a. You can grab this gauze just in case the patient bleeds a lot, so you can put it there for now. So now, make sure the bevel is up, and you're holding, with your non-dominant hand, you're holding this right here, while pointing in right here, okay? So once you go in, okay, just relax. So once you're in, you make sure you're in, and once you're in, you can go ahead and pull the catheter, the needle out while you're pulling the catheter, while you're pushing the catheter in. And now that this is out, you can go ahead and hold it like this. So make sure, if the patient is bleeding, make sure everything's good, and you take the tourniquet out as soon as possible. And once it's out, now you can connect this side. And like that. So first aspirate. Once you see the blood, and flush. After you aspirate, you flush it all the way in. 3 to 5 milliliter, okay? Alright, so once it's in, you can go ahead and connect your bandage. So you can leave this here for now while you're fixing everything in. You can take the gauze out so you can prepare your bandage. So this goes right here. Make sure there's no any openings on the area. Oops. How are you feeling, Mike?
All right.
Okay, if this happened, make sure that you have extra band dressing, okay? And that looks like it's not gonna hold on too tight. So I brought an extra one just in case. So maybe you can. So you make sure that there's no opening and this is attached to the patient, and there is no opening here for any. Here we go. Alright, so maybe you can make sure that it's connected. You can go. Maybe you can just put one here just to secure it. But it's all connected. Alright. So now you can also, while you're doing that, you can attach this one. You can do a you can attach this here for now, and you can clamp the tube while you're still preparing. Okay. So once it's clamped, maybe you can take this off and make sure that it's all connected. Okay. So now it's connected. So now once you're done, how are you doing, Michael?
I'm okay.
So now you can go clean your stuff. And make sure you throw this on the sharp container. So after this, I can go ahead and assess, document my patient. And document my patient's finding, and also don't forget to put your date and time and initial with a Sharpie or something, just to make sure that you have your initial, the date, and the time of the whenever you put the IV on the bandage right here. And then now you can document on your fixes, document your patient's finding, any abnormalities, type of solution, and your patient's reaction and on your assessment. So after that, you can go ahead and start the IV infusion set. So once you do it here, maybe the doctor orders 100 ml per hour, and I have 100 ml here. So I'm just gonna turn this on. And so I got 100 ml per hour. So that's good. And now I put 100 ml for the primary side. So once that, you can just pause it for now. So once you're ready, you can attach this to your patient. So my IV is alarming me that there's air on my tubing, so make sure that there's no air before you start the infusion. So first, you make sure, so you can take this the clip up and then try to flush a little bit of air. So now it's stopped. And now this one, you can connect this to your patient. Alright, make sure that before you start it, just to be safe, you can go ahead and clean this part with the alcohol swab, and you can attach this here. And once it's attached, unclamp this, and unclamp this one also. So now you can start the IV tube. So once it starts and it's working, how you feeling, Michael?
All right.
Good, good. So now it's working. Now you can document everything on the fixes. And okay, I'm gonna leave you right now, but here's your call light, and let me know if you need help. Okay?
All right. Okay.
And then I'm gonna put the bed down. All right, and that's it. Knock knock.
Come in.
Hello, my name is Michael Argery, and I'm here to discontinue your catheter. The doctor ordered you to discontinue now, and can you please state your name and date of birth for me, please?
Michael Smith, January 1st, 1970.
All right, Michael Smith. Let me just double check that with your wristband. Looks good. Okay, now I'm gonna discontinue it. Make sure you assess your patient, check for any infiltration, any bleeding, or any hematoma, and document it if ever there's abnormal findings. And then there's initials here, so you're good. And now I'm gonna start with discontinuing the IV. Discontinue the IV first. So stop it. And now you can start the. Now you can start to take the IV out. So once I discontinue that, I'm gonna clamp this and take this out. So now you can go ahead and flush it. So maybe flush it just to make sure that there's no any extra fluid in there. So 3 to 5 ml. So once everything's in, how you feel, Michael?
I'm all right.
Good. And now you can take this off. And take this thing off. First, take the bandage up carefully because sometimes it hurts the patient. Alright, I'm gonna take this off, okay? So once you're off, you can go grab a gauze before you pull the IV out. Okay, now you can pull this. So, grab a gauze and you can go pull it while you're doing it. And make sure you check for if the catheter is intact. It's intact. So this is good. So that means it's good. And check for any bleeding. If there's bleeding, just put a new bandage and maybe you can put like a dressing on it. But this time it's not bleeding, so it's okay. So you can dispose this in a sharp container and take this out. Now everything is good here, and then you document that there's no any bleeding. Document all your findings, and once everything's good. All right, Michael. Do you need anything else before I leave?
No.
All right. And then you can clean all your stuff and document everything before you leave. Okay. Here's your call, and let me know if you need anything. Okay.
Okay, great. Thank you.
Thank you.